This is the Indira Gandhi Memorial Tulip Garden in Kashmir. It is the largest tulip garden in Asia, and the flowering season brings tourists from all over the country. This year, the event's opening on March 25 coincided with the second wave of COVID-19. To boost tourism in Kashmir, Prime Minister Narendra Modi invited people across the country to visit the garden. And they did. But immediately, between March 25 and April 25, COVID positivity rate in Kashmir saw a 20.34% spike. Did the tourist inflow cause this uptick in the COVID-19 cases in Kashmir? The figures suggest so. On March 25, when the garden was thrown open to the public, J&K reported 131 fresh COVID cases. And just a month later, on April 25, the cases had surged to over 2,100. In the same period, the number of active cases in the valley rose from 1,290 to over 13,000. In fact, for the first 3 weeks of April, travelers arriving in Kashmir contributed to 21% of total cases. The valley saw a 450% rise in hospital admissions in April alone. But for Kashmir, tourism is a significant source of income. The security clampdown in August 2019 following the abrogation of Article 370 had been a massive blow to Valley's tourism sector. And as soon these restrictions were lifted, the national lockdown followed in 2020, crushing the industry further. The communication blockade that had been in place since August 2019 was lifted completely only in February this year, and a month later, the Tulip Garden was opened to give a boost to the local economy. But the second wave of COVID had other plans.
We jumped from one lockdown to another. ऐसा कोई हमें breathing time नहीं मिला हमारी industry को, और tourism was definitely on the front line. तो फिर थोड़ा बहुत आपने देखा होगा पिछले 3-4 महीने में हमारे टूरिज्म सेक्टर में थोड़ा मोमेंट स्टार्ट हो गई थी और हाई एंड टूरिज्म आ गया था. वो बड़े अच्छे जो जिसका हमें like we were eagerly waiting for such people to come. Those people have visited Kashmir during winters. अब पैंडेमिक जब स्टार्ट होने लगा, कंसर्न्स बढ़ने लगे हर स्टेट में, तो हमने फौरन उस वक्त अपनी गवर्नमेंट को ये बताया कि that necessary certification should be asked from every tourist or even for the local stakeholders. जो local resident है वो भी बाहर से आता है तो he should go through certification. उसका अगर नेगेटिव आता है तो he should be welcomed. Otherwise, isolation center में जब तक वो ठीक नहीं होता है.
Jammu and Kashmir does not have the luxury of completely banning tourist arrivals. Nearly 5 lakh people became unemployed in the months after the first lockdown in August 2019. In Jammu as well, with the resurgence in the virus, there has been a significant dip in pilgrims visiting Shri Mata Vaishno Devi Temple in Katra. The daily peak of 30,000 pilgrims has now fallen to a few hundred. With over 98% of the hotels closed, 35,000 persons working in guest houses, restaurants and inns at Katra are now unemployed.
Unemployment was our main concern and still it is a concern. If you see since last 1 week, we are making appeals to our J&K government that for downtrodden people or for these daily wagers people or who earn daily, be it a vendor, be it a shopkeeper, small shopkeeper, or be it a auto wala, any transport related, government should come out with a relief package. Some relief announcements like free ration, financial assistance. So my issue is not today about revival of businesses. We are talking about the people those who are not earning anything.
Meanwhile, every 5th person tested for COVID-19 on RT-PCR in Jammu and Kashmir this month is returning positive. In addition, COVID-19 fatalities have also seen a sudden spread. While in the first 2 weeks of April, 52 people succumbed to the virus, in the last 2 weeks of the same month, the toll rose to 237, which is nearly 4.6 times that of the first 2 weeks. And in the first 11 days of May, the UT has witnessed 564 deaths.
One big factor which gives us to understand that it could be a mutant because the virus has become aggressive. it is not behaving the same way as the original strain was behaving in Kashmir. It's attacking young, it's attacking pregnant. We're losing young people. When the cases outside were rising, the Kashmir was allowed to be still the popular tourist destination. And not only that, the festivals were organized, and the gardens were opened for these tourists and the locals also. That could be a big factor, that because of the tourist huge influx coming in thousands, and this mutant possibly has sneaked in.
But to know for sure whether any mutant is responsible for the surge, genome sequencing needs to be done. However, Jammu and Kashmir has managed to send only 1% of total samples for the sequencing. The lack of trust in the government does not help either.
More importantly in Kashmir is people developed a mistrust with the authorities, especially the government, because possibly things were downplayed, that everything is all right. As a result of which people got lax. One, they abandoned the precautions. Two, and then in a way, once you tell them that everything is all right, then when they go to the hospitals and see those horrific scenes for themselves, there is a mistrust that we are not told honest things, we are not told the truth. So that there you start that they will not then believe you. They will not follow your instructions.
Given the surge, the Union Territory is currently under a strict lockdown, which has been extended till May 17. On May 7, the Union Territory reported its highest number of daily cases ever, with over 5,400 fresh cases of COVID-19. The active caseload has already crossed the 50,000 mark. Much like the rest of the country, the surge has put pressure on the existing health system of the valley. Tertiary care hospitals in the valley are running out of dedicated ICU beds.
See, we have a lot of problems because this is an isolated place in a way. So we are dependent on the vaccines from rest of the country. We are dependent on the drugs from rest of the India. We do not have that huge infrastructure. That the funding is also minuscule, to be honest. So we don't have enough of intensive care units to combat it. We don't have separate hospitals for COVID. We really need, I think, 10 times of the beds we have, ICU beds.
On the vaccination front, the shortage of vaccines has hit the Union Territory hard. Last week, over 80 centers in Srinagar district and over 20 centers in Jammu were not able to provide vaccination service due to shortage.
Huge number of people in Kashmir are still unprotected, unvaccinated. If you go to the ministry data also, you see just 3 lakh people, over 3 lakh people vaccinated, having full 2 doses, so they're protected. And you have still 97% people in JK who are still unvaccinated. So it's a huge number. So virus will go on finding its host. So that also could be a factor of resurgence of cases.
Tourism may have given the initial push to the rise in cases, but the surge has been sustained by various other factors such as the presence of mutants, an unvaccinated population, and lack of COVID-appropriate behavior. But if tourism has to return to Jammu and Kashmir, the vaccination needs to be stepped up and health infrastructure needs to be strengthened to withstand subsequent waves. COVID is here to stay at least for some time. Zulfikar Majid reporting for Deccan Herald from Srinagar.